Quest Diagnostics CEO. Steve, good to have you. Welcome.
Thanks for having us, Sarah.
My first question is, now what? We are seeing a drop in cases, which is welcome. Vaccines are here and happening, and yet so are new variants and spreading in this country. So what does demand for testing look like over the next few weeks and months?
Yeah, so we're watching it carefully. This winter, we hit the third wave, and we had a very strong fourth quarter for testing, and that's continuing into the first quarter. But what we see happening right now is we're starting to see some drop in some of the measures we look at, positivity rates, hospitalizations, and we do believe that the testing volume will come down for COVID throughout the second quarter into the third quarter. And we're watching carefully what will happen in the second quarter with the new variants as well, and with the measures that we're taking around public health, in particular the vaccinations. And at that point, we'll be able to assess what we do going forward to get back to life activities.
On those new variants, Steve, how well do your tests overall hold up to them? And I get that you're not doing the gene sequencing or analysis that we need to find the variants, but do you have a sense of how much of that is happening based on the testing you're doing?
Yeah, we actually are doing the sequencing to determine the prevalence of the variants that we see coming into this country. We have worked with the CDC, and we'll continue to do studies to see what's happening with some of those variants over time. And to answer your first questions, our testing stands up very well with what we've seen so far.
Steve, will the identification of the different variants become like for like with just doing a positive or negative COVID test in the months and weeks ahead, or will that always have to be a separate bit of diagnostics as opposed to part of the initial test?
Yeah, for now, it's a separate piece of diagnostics. It requires sequencing. And we're not certain if it adds value to know what variant you have. We're learning more as it goes on. But right now, the testing that we do would pick up the virus, whether it has a different variant or not. And we're just watching that carefully to make sure that doesn't change.
One of the biggest questions throughout this pandemic, Steve, has been how lasting immunity is from those who've had natural infection. Are you seeing reinfections, those taking tests through Quest, especially with these new variants?
Yeah, so far we see very limited reinfections, those that have had the infection. And we see that either in the positive test result or in the antibodies. And we do serology testing to test for those antibodies. So reinfection has been very low. And that's true in our own data, in the data we see from others. And we're watching that carefully to see what the durability will be for immunization. And that's true for the vaccines, but also your natural immunities as well.
Steve, thanks so much for joining us.
We appreciate it. Thank you. Have a great day.
Shepard Smith here. Thanks for watching CNBC on YouTube.